I picked up the telephone and called 911. I told them that I needed a rescue squad. I told them that Tom and I had difficulties.
Tom and Betty, an older couple who have lived in the Woodland area all their lives, were sick. The rescue squad picked them up and drove them to Roanoke Chowan Hospital.
They took us both into emergency department, and they gave me something for my pain. Kidney hurts really bad, and they gave me something for the pain and an IV to make me comfortable. And they're checking his blood clots and see what to do about those. Yeah, they put us side by side in the emergency room, so we knew what was going on with each other. And we stayed in emergency a little while to they decided to take us up to the second floor. They were very kind to us in the emergency room. They all were checking on us and making sure we were very comfortable.
Betty, who has been blind since birth, was suffering from kidney colic, and Tom had severe pains in one of his legs. The ED staff kept the couple close to each other and explained what was happening to Betty. They tended to Tom first, finding a blood clot in his leg. He was admitted and taken upstairs to a room. They treated and released Betty and made sure she got back to Tom's bedside.
What I would really like for everybody to hear from me as Tom and Tom's sister and their caregiver along with Betty's mother, is that the care and compassion that was shown to Tom and Betty when they were at Roanoke Chowan Hospital was just amazing. I have been a nurse manager for 30 years, and I have never seen a group of nurses and aides who provided more compassionate and caring service than Tom and Betty received. The social workers were wonderful. The doctors were fabulous. They went back and forth between the rooms to tell Tom and Betty what was happening with each one of them. One of the things I think that was the most striking to me was Tom had an accident with his leg. He wasn't able to get to the restroom, and he had an accident in the bed. And the aide who came in to help him get cleaned up talked to him the entire time and treated him as if it were a privilege to her to be able to help him. It was the most wonderful thing that I have ever heard. I was outside in the hallway, and it made tears come to my eyes that anyone could be so kind and so gentle with someone else in that situation. It was wonderful.
When it came time for Tom to leave the hospital after recovering from the blood clot, it was apparent that he and Betty did not need to return home by themselves. Susan Farmer, a hospital social worker, was able to get Tom and Betty a room at the villa in Rich Square.
When I met Tom Bridges and his wife Betty, I really wanted them to stay together. They were very dedicated to each other, and they were very sad because they were going to lose their independence by living in their own home, because they realized that they were no longer able to be independent and to meet each other's needs. Tom had always taken care of her, and she had taken care of him, and they had managed to do very well. But because of the deterioration in their medical conditions, especially Tom's, they knew they needed to go to somewhere that could help them with their medicines, make sure that their basic life things were met. And so we found Rich Square Healthcare Center because they were going to let them live as independent as they could, but they would make sure that they had their medicines, their food, they'd still be able to be together, provide care for each other in the ways that they could, and it was just going to work out because they were both so sad that they were afraid that they weren't going to be able to be together because they had been together so long.
This wasn't the first time that Tom had been treated at Roanoke Chowan. He was born here in 1951. He was premature, weighing a mere 2.5 pounds. Tom was at the hospital for 2 months before he got to go home.
Tom has certainly been through a lot, both he and Betty, and they've struggled their lives to be independent people. They have worked together to support each other. Tom now says that he's the eyes and Betty's the brain, because in the beginning they didn't expect him to make it, but he did, and they gave him exquisite care. And I think the thing that's so important to me is the fact that now, as a 60-year-old man with multiple difficulties, he has received the same kind, loving care that was shown to that 2.5-pound baby 60 years ago.